You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. Okay, so tell me more about the course, because we were just talking a little bit about like your efforts in learning more about truth and reconciliation and DEI and like Indigenous relations in Victoria. Okay, so tell me about this course that you just took.
Oh, yeah. So it was, now would have been March of last year. It was something where, like I was saying, I was trying to get some more information for our own clinic to help with like language around like intake forms and like healthcare, I guess you can say like expectations and, what First Nations people kind of need that's important to them too, and like their recovery of things, because obviously things are quite different between different cultures. And so I just emailed the VNFC, the Victoria Native Friendship Center, and just asked them about like, hey, like, do you can I talk to somebody? Obviously I want to pay you guys for your time. Do you have like consultants or people that do that sort of work? And so they just kind of mentioned there's this course that was available, and I was like, happened to be on like Thursdays, which is my days off. I was like, perfect. So I signed up for that. And it was two full days of like various kind of healthcare providers. So there was, I think I was maybe the only physio there, but there was nurses, actually a lot of people from the BC Cancer Agency, which was really cool.
Interesting.
And there was like counselors and a whole bunch of different people. And so we just kind of sat in kind of like a big kind of like circle sort of thing, and just kind of talked about like the history of all the residential school stuff, and like actually the history of like some like how like health care was handled. And things like that. So things I never even knew about. So it was very it was very like eye-opening and super informative. And this is, I'm like, I wouldn't even have known about it. Even if I like looked for it online, I still feel like I wouldn't have kind of come across any of this stuff. And so it was like a lot of the stuff that obviously came out was like really hard stuff to hear, and you just can't believe that sort of stuff actually happened kind of like at home, or even it's like in your own backyard too. You're like, oh my God, like how can you do this to a human being?
Right.
And so it was just like, but I mean, so it was kind of like the first day was you kind of hear about all like the hard stuff and everything that happened, and like, but then like okay, no, we're going through all this stuff because we want you to know, like, obviously like the foundation of everything that happened, like why it is we need to kind of take us from like here through these steps, and like what people can do, because like once you know what happened, obviously now you know what needs to be done. So that was great having all that background info, and then it was just like, then it obviously became more of like a positive note.
Yes.
To the rest of it too, in terms of like, hey, like this is what we need to do. Like this is like, we're not screwed totally here. Like there's a lot of bad stuff that needs to be fixed, and it's going to take some time. But at least they kind of gave you like a foundation of like what needs to be done to kind of move forwards, and and just trying to be just sensitive to different kind of cultural practices. Like, I mean, one example, it would be a bit like I don't think it would probably happen too much in like physio clinics because we're like lower risk usually when we kind of see people, but I think it was really good to see healthcare providers like BC Cancer Agency there, because if like family's really huge for First Nations, like they need to have like, sometimes they want to have their whole family there, and that's perfect, and that's really important to them, and they do prayers and all these other sorts of things too. And a lot of times like the healthcare settings are not set up for that, and so then people can't come and visit, and they can't get what they need, and that really impacts them in a negative way. And so it's just trying to make sure you're just kind of creating spaces for people too that are going to give them the best possible outcome as they can, and just give them what they need, and support and that sort of stuff there with it too. So there was just like lots of stuff around like kind of what we need to do, like we need to restructure a number of different things, and just like just like wording about stuff, and just being sensitive to things, like I ask questions obviously, and because people have been really kind of judged harshly in the past, or kind of brushed off and that sort of thing too, not taken seriously. And so, not that we would obviously kind of, I think physios were pretty good at that. I mean, obviously I know there's rotten eggs in every profession. So, but yeah, but just being able to kind of like, yeah, just obviously, just like we always try to strive to do is like, obviously no judging, keeping an open mind and that sort of thing there with it too. And just really kind of listening. Cause I feel like a lot of times that hasn't happened with First Nations populations. They get unfortunately targeted in a lot of cases, and it's just brutal.
Yeah.
So
Absolutely.
yeah, so it was this, I mean, sorry, that was kind of a ramble, but it was a lot to take in, and it's one of those things where you left with more questions than you had kind of going into it. But they were amazing people. They were everything was like so thought out. Like you'd be like, wow, like they put a lot of time into this, and there was just there's this I can't even put it in words. There's just so much to take away from it.
Absolutely. And the
Cool.
fact that it exists, and like,
Yeah.
I mean, what an amazing resource. And like, I would probably, just based on that amazing, like, kind of recap of it, like, that's something I would totally pursue and want to learn more about. So you said it was through the Victoria Friendship Society, but that was in person. Like, do they deliver anything online for people who are not in Victoria? Do you know?
No, they didn't do anything online because I think a lot of their stuff they were trying to keep, I guess, kind of private to some extent, because like they're like really specific about like, please don't share these manuals, please don't like photocopy stuff or things like that. And I think it's just because there's a lot of like people's like personal stories and a whole bunch of things, not like necessarily like names. There was some names kind of mentioned in there, but I think it was just, they're just trying to respect the people that
Absolutely
were really kind of shared and were really vulnerable kind of like through the whole process there with it too. So I mean, I'm not sure if they have any plans to do stuff online. I mean, I hope they can figure out ways to do it, because it was great. I know like I know the PABC's done some fireside chats with Len Pierre, I think his name was, and he had some really good stuff there with it too. And so it's just a lot of amazing resources out there too. And I think even like U of A has a free Indigenous healthcare course, I want to say, as well, or at least just kind of learning all like the background stuff behind all the truth and reconciliation thing. And
exactly. Like, I think hearing the stories and getting the context, like, that's just laying the foundation. It's so important. When I went to just this past weekend in Vancouver, PABC had like a networking and award ceremony event, and our Indigenous knowledge keeper Tanya, she spoke at the very beginning of it, and again, just like this beautiful story about her mother and the trauma of it all and what she's going through now, and she tied it in so beautifully with the physiotherapists that they're working with in the hospital right now, and the role of physio, and how that was like a really helpful role in educating her mom about the specifics of her case. And she just was like, it was the way she told the story was just so beautiful and like intricately woven. And, she blended the like history of residential schools and like the trauma and everything there, and how it's still, it's still active. Like, it's still, the residential schools may not exist in this moment, but the damage that was done is still there. And we have to be sensitive to it and aware of it, and reach out and build those bridges. And I mean, it's like you said, it's a long journey, ahead of us. But I think the first steps really are learning from, Indigenous knowledge keepers and taking courses like this and integrating the language and, just looking for where we can bolster ourselves and our knowledge and our sensitivity, I think. So cool. Really amazing resource.
Yeah, absolutely. Oh, for sure. So if it ever pops up, I mean, 100% recommend anybody. I mean, like, obviously in the Victoria area, but like I would travel for it even.
Exactly. Well, and I wonder too if there's like some in the Okanagan or the Lower Mainland, because I know there are friendship societies in different locations. So I think it's really just about like looking forward and reaching out to it. And I've actually just started working with Interior Health, and there's lots of really great resources within Interior Health as well. So really enjoying learning about that too, which is neat. Okay. So we kind of just like jumped right in, but welcome, Evan. Thanks for joining. This is amazing. Like, what a cool way to start. I'm really pumped. So I want to just hear a bit more about your clinic. You're in Victoria, obviously. I want to hear lots about, like, tell me about your clinic. Tell me about your journey to becoming a physio, and what you do now.
So, so I'm from Langley originally, and so I came over to UVic in 2002, and I did my kinesiology degree there, and then kind of took my time, we'll say, I did like 6 years to do that degree, but there was reasons behind that. I was kind of changed path of which way I wanted to go. I was thinking about med school maybe for a bit, and then I just kind of, one of my profs actually kind of almost, he was a physician, he kind of talked me out of it. He's like, oh man, if I could do it all over again, I'd do physio. He's like, he's a GP, which is a tough job.
Yeah,
absolutely. You're in demand, kind of pulled in a bunch of different directions all the time. So yeah, it was one of those
that's
things
a profession where it's hard to stay boundaried.
Yes, yeah. So he's like, yeah, no. He kind of like talked to me. I was already thinking about physio in the first place. He's like, oh man, like, don't do that. If you want to be in a place where you want to see people like do well and recover, it's a bit more positive. You don't have to worry about memorizing all these medications and all these other sorts of things. He's just like, he's like, just go the physio route. So so I did that. So I kind of had to change some of the coursework around, which was fine. And then I worked as a kin for a year and a half or so out here, and then did some traveling for about 5 or 6 months after that, and then went to physio school. I went to Western in Ontario, and then me and my wife met there. And the joke was that we got introduced because my wife lost her plate of food all over my favorite shirt at a barbecue, and then started to wipe it off me, and I was like, hey. I'm so sorry. I'm like, that's okay. It's like kind of like a movie thing, but it was funny. Somebody knocked her plate out of her hand, really animated with a story, and just whacked her plate out of her hand and went all over me. But
serendipitous. It was a serendipitous. Yes, totally. That is very much a rom-com intro.
I did the 2-year master's program there, and we moved to Oakville and worked at different clinics there for some large physio corporations, and and when we kind of moved back out this way in 2014. And usually, obviously, with physio, you don't get a lot of time off, or if you do, you kill your caseload. So we were like, okay, well, let's take advantage of this. So we went to New Zealand for 6 weeks, which was awesome, and then came out here and then worked for smaller clinics in different parts of the city. And then we just decided to, wanted to kind of open up our own space, and so we were kind of looking around for a while, and in Victoria anyways, there's the lease is kind of a raw deal if you're like the tenant, I guess you can say.
Yeah.
There's a lot of these things called like triple net leases, and it just pretty much puts everything on the person who's leasing, and the landlord has like no responsibility or anything to it. So they just get to pull in all the money. But so we were kind of looking around. There's some places that are really nice, and we're just like, I don't know. And then we just kind of came across this space that we're in now, in this kind of newer development called Dockside Green, and it was like for lease or sale. Mm-hmm. And so we're like, whoa, commercial place for sale, like that's pretty rare. And so we happened to buy our home in 2015, and just had the good luck of like the market just went, and so we refinanced our house to buy the clinic space, and that was terrifying.
No doubt.
But yeah, and so, but like the space was like wide open, empty. There was like nothing in it, so we had to start from scratch. So we had to like have the space built out, and so obviously we purchased it, built out the space, and I'm glad we did, because to sink like a ton of money into a full reno and then be told, oh hey, you gotta leave because we're gonna do something different with the space would be just crushing. Let alone you have to like move your business to another part of town, or just anyway, after you kind of set
and
up.
Usually you're the one responsible for undoing the renovations too. Like you have to return it in the same state you got it.
Yeah.
Wow.
So it was like, so we just kind of went kind of all in on that one. But it was good, because like through COVID, like we didn't have to. I mean, obviously we had to pay the mortgage and that sort of thing on the space, but like we weren't having anybody jack up any prices on us or try to boot us out or things like that, or even at any point too. And there was a clinic up the road, and it used to be in a Good Life, and Good Life closed that location down because they had their lease jacked up, and so then they left, and then the clinic that was in there, because I know a couple of physios there, just like, okay, so then they had to like relocate, and after they put in a ton of effort to kind of set up shop there, and so so it was just one of those things where like, okay, we're just gonna jump right in and go from there. And so initially, my wife had to burn out a non-compete clause for a year, and so she had to go to a different clinic, which actually worked out really well. That's far enough away from where she used to work, so she and it was good because they wanted a pelvic floor physio for a while, and so like Kathy just kind of told me like, hey, like I'm I have to be honest, like, I'm only going to be here till I burn out the non-compete. They're like, oh, that's fine. Like, we just want to get this up and running. So she worked with them, and there's still a great relationship with them. We cross refer because they're mostly chiro and massage, and we don't have either.
Oh, perfect.
And so that's really worked out well too. And so it was just, and so initially, I guess when we like Kathy wasn't able to kind of work at the clinic, so it was just me and the dog for 12-hour days.
So you were the sole physio initially?
It's at the start, yeah, and then like Kathy was obviously helping me with all the other stuff, and we were trying to get things
all the operations.
In terms of like clinicians, that was just me for
oh my gosh,
a couple months or so, and then we hired an admin, and then like another like kind of physio kind of part time, and then it's kind of slowly built up from there. And so that was December 2017. And then now we have, I guess, technically 7 physios and a dietitian and 2 admins. Yeah. It was, it was, nope. How do I even put it into words? I'm glad we had some time under our belt before COVID, because I know places and physios that hadn't, and that really was a blow. Or they just signed the lease, and then they're like, okay, cool, we're ready to roll. And then next day, okay, everybody's closing down. So they have to like let all their staff know that they just hired and lose the space and all that sort of stuff. So, so at least we had some time under our belt. We had a little bit of clientele kind of going there with it too. And, so that was good. So so now we're kind of in like trying to do the timeline here, kind of like year 8 or 9-ish or so.
Right. Yeah. And you've kind of like found a rhythm now, and you're like, I have a regular schedule. Like I have other staff to, does it feel a little bit more like, I can breathe again now, or there's still lots of stresses?
Yes. Yeah, for sure. And so, so like, I think at this point like things are good. I mean, obviously there's still lots, because like we have 2 little kids, and then so we're always doing some form of work. And I think by now, I mean, which will probably kind of build into like some other things we talk about too, but I think we thought we would have been a little further ahead by now than we are, and we've had a bit more kind of freedom, but we're still not quite there yet. But we are getting there for sure. But we're pretty lucky in the space that we're in. It's a pretty active part of town. It's near development, so and we're kind of one of the main clinics in the area, just over the bridge, just far enough away from downtown where there's like lots of clinics.
Fair enough.
We have a great team of people. We all kind of have our own thing that we really kind of enjoy doing, in terms of like some like one physio does the vestibular stuff, and then Kathy, another physio, does like pelvic floor, and I like doing like the orthopedic stuff, but then like doing like concussion stuff and bike fitting. That's my jam right now too. So so there's lots of stuff to kind of offer, but mostly physio. We would love to have like a clinical psychologist or somebody in that realm, and probably 1 or 2 RMTs would be sweet. But so that's
hiring
kind of is tough hiring these days. It's
hiring is a challenge right now. Not just physios, like RMTs, like everything right now. Like, so you have 7 physios, and how did that hiring process go? Like, when did you most recently hire a physio? Because I'm curious to kind of know what the timeline is, because it feels like right now it's so hard.
Yeah, so it would have been November was when we got a new physio kind of join us, and he's great. I should back this up more. So classically, we've been very lucky and in some cases kind of naive with hiring there too, because we've never put out an ad for physio, but somebody always ends up falling in our lap in some way or another, which is, and then we just got like overly cocky, like, oh, we don't need to worry about this, we'll find somebody, no problem. And then it's just like, oh god, no, we need somebody else. But like our first physio, she, I was trying to remember how she heard about us, but she just kind of approached us, and just kind of looking around, just kind of, because she was kind of between two clients. So you just wanted something kind of part-time. I'm like, cool, I just need somebody to help me out here right now.
Yeah,
I will
just like, let me breathe, please.
Yes, please. And I kind of knew her a little bit through Kim already as it was, so I knew she would be a great fit. And then our other physios also just kind of happened to reach out. One was looking to kind of switch clinics because they just wanted a bit of a change of pace, and the other one was kind of like a newer grad at the time, and she was interested in doing pelvic floor and knew Kathy was doing it, so I think she was looking to kind of get some mentorship stuff from Kathy. And then we've had some other people kind of like come and go, but again, they just kind of found us on their own. And then the most recent guy that joined us, he was at another clinic kind of like further out of town, and he happened to move like 4 houses up the road from the clinic. And I was like, oh, and he's great too. Like, he's awesome. He's a newer grad. He's been out for like a year and a bit, but he's great. And so like, so we've just been super lucky. And then like, and somebody's like overly cocky, being like, oh yeah, we'll find something, no problem. They'll just like come and flock to us, and we'll be made in the shade.
But what that tells me is you've clearly built a solid reputation, and like, having spent so much time in Victoria previously, like in the industry, you have relationships, like there's clearly a reputation built and a level of trust that people have in your business. Like, you know, like what that tells me is you've done an excellent job of like, you don't have to do a ton of marketing because you've obviously got these relationships and like community built, and, you know, trust and word of mouth is something that is clearly working in your favor. So I think that's actually a really great sign.
Yeah, no, for sure. Yeah, absolutely. So and it's just icing on the cake when people's personalities are good.
Yes.
They're solid people. So we're very lucky. They're very skilled and they're very good people. So, and they just, everybody gets along, and like, you know, they're hanging out after work and all that stuff. So we're just like, oh, good.
Yes, exactly. Yeah. And that saves you from having to like hire a whole HR team and like handle all of that piece, because we all know that that's very expensive, and the margins of running a clinic are like not conducive to being able to hire one of like every single division, marketing, HR, like, you know, like we kind of do it all as the owners. But and I'm sure we'll dive into that a little bit more. But I'm really curious to know, like, so you started in 2017. I mean, I would love to dive into a little bit more about like the buying versus leasing process. But I think the more important question that I want to like dive into is, how on earth did you survive COVID? Like, how did you pivot? Because for those who don't know, physiotherapy was completely at a standstill in the private sector for 3 to 4 months. There was from March until almost June, physio was like dead in the water. Like, you couldn't work. So how did you get through?
Right. So we were kind of looking at a few things. Well, I guess it was me, because I'm a bit of a tech nerd. Or it's like, because me and my wife kind of have like different parts. Like, she definitely takes care of like the financial stuff and staffing and schedules and that sort of stuff. And I'm kind of more like, like kind of patient experience, website stuff, SEO, like the tech things. And so even like, I think like 4 or 5 months before that, I was just like, I just kind of was just like, oh, telehealth. And I was kind of like looking at that and being like, oh, like, how does this work? Like, this kind of seems like it kind of would be kind of neat for people that, if they can't make it into the clinic for whatever reason, or they live kind of out of town. And I just thought it was kind of like a neat thing. And then I just kind of like put it to bed. I didn't really think about it too much. And then when COVID popped up, I was like, oh crap, I gotta do this now. And so it was, everything closed down really quickly, like boom. And then I was like, okay, I gotta do this stuff now. And obviously my wife too, it wasn't just me. And so we turned it around in about a week. Like they said, I changed like all the stuff on Jane, like just rewrote all the stuff, or like added things and be like, oh, this is unavailable temporarily, so we've kind of switched to this sort of thing. And so just had to like completely change your whole business model entirely. And so this is a case of just like, like just combing through everything. Like I was up, oh my God, I was up so late, just like doing stuff for just like a week, and then boom, managed to kind of get things going on like the Monday. And then of course too is all these questions about like, how do we do this? Like, are we allowed to do blah, 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 or this or whatever? And so
regulation aspect, but also like, our insurance company's going to cover it. Like there was so many questions. I remember that. Yes. Yeah.
Yeah. So it was a big thing too, where we just had to put out there like, hey, this is what's up. It's probably going to change as we go, sort of thing. And like, actually I forgot about the insurance thing. Like I remember I was having our admins, because we managed to retain everybody on staff, which was great. We had to, I think, I'm trying to remember now. We kept our physios. I'm trying to remember if we had to technically let our front staff go, but we kind of paid them a little bit on the side just for some odd jobs there too.
Yeah, totally.
CRA, if you're listening, CRA, sorry. I did, we played with the rules. And so it was, it was a case where like you said to switch things around really quickly, and then we were always like, I was like, hey, can you check like the Canada Life website, like are they made any comments about like blah blah blah? And so we were just like, every time we saw something, I just made sure I went to our social media and be like, hey, just so you know, like Canada Life is now covering telehealth and sort of stuff like that, because initially it was nobody, or it was like some word but they didn't really make it that known. So you're like calling through, are they covering that? So I just remember going through all the insurance stuff, trying to figure out like who in the wording, hey, who can we list to show that, hey, like people can still do this. But it was mostly people kind of paying out of pocket. So I think, through that whole thing, we was like ripping through that week to change everything. And then like the following week, it was like kind of crickets, because everybody was like, what the hell's telehealth? Like, I don't know. And this isn't physio. Like you can't touch me and like do stuff. And so it's just like trying to explain, like, I felt like we spent like a month and a half explaining how it works, and then you were halfway through COVID already. So after that switch over, like we were probably about maybe like 25% as busy. I think other clinics were probably doing better than us for that sort of stuff, but it was kind of slow. But and it was weird because it was like sporadic, because you'd be like, okay, I'm going to see this person for half an hour, and then we're going to go on the rest of my day. And then, I got this other appointment. So you kind of jump back between, like we had it set up so we had like on our TV in like our back room at our old house.
Yeah.
And to be like running in and out of the back room kind of every so often doing things. And so, but I felt like the people that did see us were our kind of like our core people. Like they were great. They supported us all the way through. Some people were just like, oh yeah, like I just want to check in. Like I don't really, I think everything's going okay, but I just wanted to like give you guys some money. And I was like, you don't have to do that. Don't worry about it. But like, there's had like the people that were there for us were just like really like our solid clients, and
amazing.
And even though we weren't as busy, I felt like I'm a big talker, maybe too much. And so I was actually okay with it. I thought telehealth was great because you could have these conversations with people that you probably wouldn't have in the clinic. So it's like, okay, well, if I can't do any hands-on stuff, like
education,
what else can we solve? Like what other problems are going on? Or can I watch you do your exercises at home, and then you can actually see what they're doing? You're like, oh, like I didn't really say to do it that way, but that's okay if you've been playing around like that. But let's try some other stuff so you can actually see people like in their own environment. And I think people too, since they were in their own environment, instead of the clinic, like people generally like they'll kind of relax a bit more. It's like more kind of info kind of comes out, which is a lot of it's like really helpful to have. It's like, oh wow, I never knew that. And so I just felt like the conversations were a bit deeper, and like you just really got a better understanding of people. And so because there's more space for it. So like I thought it was sweet. I really kind of like the telehealth stuff. And there's times where you're just like, oh God, I just want to be able to just do that test, and I can't. But that's the nature of it. And so, but we managed to kind of do it. And I felt like because of that too, you kind of became like a better clinician from it, because you just had to use your ears more. So like you're just I feel like your diagnosis kind of got a bit better, which I felt kind of even kind of carry forward now, where I'm like, before I'd always like spend a decent amount of time kind of talking to people, but now I'm just like, you're just hearing better, so that actually makes the rest of the assessment better, because I don't have to do as much stuff now because I've already got a way better understanding from just like using those skills pretty much from before. And so I'm off on a tangent.
No, I think it's huge. Like, I love telehealth. And when I was working in my office in North End, every time I would get a new referral, I actually would I changed my whole model. Like, I actually did all of my initial contacts over telehealth initially. So what I would do, because you get a new referral or whatever, I found I was spending so much time on the subjective that they'd come in for an hour initial assessment, and then we'd spend 45 minutes talking. And then I was like, I only have 15 minutes. This is crazy. So I actually shifted to doing telehealth for all of my initial assessments for that exact reason, because I was like, now there's zero expectation of like treatment or, whatever on this conversation. So I would book it for like 45 minutes, and then I would have tons of time to ask all the questions and see them in their environment. And I found I got so much information by doing it online, because you were free to talk. It was just this like amazing subjective history, and like you'd watch them move a little bit or whatever. But I found it so good, because then they would come in for that hour, and I had the full hour with them hands-on. Like, it was like, great. Now we just dive straight into like visual assessment or like diagnostics or whatever, and treatment, and whatever that looks like. And we've gotten this like subjective piece out of the way, and I loved it. And I like, now I'm doing a bit of like, I do the odd house call here in Kamloops. So if I ever get a new referral, I do the same thing. I'm like, before I actually like come to your house, I'm going to see you online, and we're going to, make sure this is in alignment, and this is like, get the subjective history, so that when I show up and set the table up, like, we're actually not just like sitting on the couch for 45 minutes talking first.
Right.
Right. Like, I just found it like opened up an opportunity to just like streamline things massively. So same thing, even like follow-ups, like I still do the odd follow-up, because someone might have had a new injury, or like, maybe they just want to like talk through something that they're doing, or, like, I find there's so much you can do with telehealth. I'm a big fan. Big fan.
Yes. Yeah. I remember you saying that too. So that's,
Yeah, it's wicked. So did you guys have, obviously, I'm assuming like pretty massive revenue loss though as a result? Like, did you have to really like nickel and dime things? Like, how did you survive on the financial aspect of that?
Yeah, I mean, we had the oh my God, what's it called?
Oh, I know what you're talking about, the loan, like
business version of the
the CBA or whatever. Yeah.
So we got that pretty early on, so we were definitely hanging on that one. I think it was, like, we didn't have to worry too much about the clinic stuff per se. We had to keep like paying the mortgage, but otherwise, like, that was kind of like lights off. Well, that's where there were the two, but
right.
I don't know. We just kind of like just tried to keep costs down as much as we can, and just like at home and stuff there with it too, just trying to spend as little as we could. Like, we were kind of obviously kind of bleeding money a bit, but we did have that loan to definitely support us, and so and like a little bit of income. But we were just trying to just kind of keep costs down. Honestly, I don't even remember too much about it, but I just remember just like trying to just doing as much as we could to kind of obviously get appointments going and that sort of thing, and with the spending the least amount as we could.
Yeah,
totally. It was like the main thing, which is super simple.
Exactly. Just don't spend a lot of money.
And so so we kind of went through that, and then what was kind of a really good thing that happened though was that since we were like a smaller clinic, and like we'd been operating for a couple of years, but like there's like really big clinics in Victoria, and they have like a huge client base and everything, and so I think a lot of people that were like, oh, okay, things are open, I'm going to go back and see my physio or massage therapist or whoever, and they couldn't get in. They were just, everything was like plugged up because everybody just rushed back, and so if you didn't pull the trigger quick enough, you're kind of stuck in like, oh, how long is the wait list? And it's like, oh, like a month or longer. And so I think if some people were kind of on the fence about who they were seeing, or like, oh, like maybe I should try something else. So then people are just like, oh, hey. And then, so we were able to get people in like a little bit kind of quicker. I mean, people still had to wait a little bit, but it was definitely like faster. So we picked up like a huge number of new clients.
Amazing. So you almost like got kind of the overflow from the clinics that would have traditionally had, like people who would have like, like the big clinics that
Yeah.
people would have traditionally found on Google or whatever. Yeah, you guys got
Yeah.
the overflow. That's actually like, and I agree. Like, I think it was actually a huge benefit to be a smaller operation during COVID, because I think the bigger operations, like their overhead was just so high.
Mhm.
And so having, you know, a smaller operation was actually probably a huge benefit in that time frame. Huh. Interesting.
Yeah.
And like,
Yeah.
you made it, you got through. And then at the end of it, like this, like abundance of clients, that's huge. And you also, so you, I know you have 2 kids and you work with your wife as well. Like you guys co-own the clinic. So it sounds, you have, your kids are 4 and 7, I think you were saying. So you must have had a child in that time frame as well, like prior and then during. How was that?
So we had our daughter. She was born in 2018, and so
Okay.
with COVID, we didn't really ever have her in daycare. Like we just, because we were on opposite schedules, so she is always kind of like with us and stuff, and which was great because we don't have to worry about exposure to other kids and people and everything. So she was just kind of with us kind of through that, and so she probably doesn't remember because she would have been like 2. All she would have remembered is this me and my wife running around in sheer panic. So and then our son, he was born in 2021. And so, quickly we kind of, I think he was born at like 1:30 in the morning, and then we were out of the hospital at like noon.
Wow.
It was a pretty quick turnaround, so, which was fine because I didn't really want to hang around the hospital too much anyways.
Not during that time frame,
but,
especially.
but by that point, things were kind of up and running a bit too. But yeah, we always like, we didn't really have too much kind of childcare, and like my parents are out this way, but my wife's family's all in Ontario, so we didn't have like a ton of like family coming in to try to like as a daily thing to kind of help us out. So yeah, it was tough. There's like a lot of like swapping work stuff and kid stuff with it too. It was it was hectic, but we managed to get through it. And kind of like I was saying, like we kind of have like our both different kind of areas that we kind of do well with in terms of like working on the clinic stuff. It's like one kind of complements the other. So
and that's huge, because I'd imagine like, you know, it's challenging enough to open a clinic, and then, you know, like having a family together and like being business partners, like there's a lot, right? Like, and that can put a lot of stress on the relationship too. But yeah, it sounds like you guys have found like a really nice like yin and yang balance that makes it work really nicely.
Yeah, for sure. Yeah. And it's funny too, because like a lot of people say, oh, like, how's it, you know, owning a business with your partner? I'm like, well, it's good. I mean, like, it's good because, like I said, we have like our separate. It'd be worse if we both liked doing the same thing on the clinic and both hated the same thing. Like that would be terrible. So luckily, my wife is much more financially literate. I'll say we'll walk out of our accountant meetings and I'll be like, "What the fuck was that? I don't know what did he say?" He's like, "Don't worry, I got it." Like,
she's like, "I've already got the spreadsheet made. Don't worry."
Yeah. So it's good, but I mean, and it's tough. I guess one thing that would be kind of tough about doing clinic ownership with your partner is that it's always like there, like even at home, like you're talking about stuff and that sort of thing too. So like it's great having somebody in business that you know well deeply and you trust, which is great. They're not just gonna like flake on you or anything like that. But it's tough because you're always kind of like talking about business stuff at home. It's like, oh god, I gotta turn this off. So
your lives are deeply intertwined. So I'd imagine there's a lot of like at work, you're talking about what you're going to have for dinner. And then at the dinner table, you're talking about work.
Yeah.
But yeah, I mean, like you're absolutely right. Like there's something really amazing about building something with someone that you just trust so deeply, because, you know, like you hear horror stories of businesses falling apart because, you know, a business partner flakes out or does, you know, like it just exactly. So that's actually like a really cool thing. So yeah, you guys like, it sounds amazing.
And I mean, we're on opposite schedules as was too. And I think some people are just like, oh man, like you see your wife all day at work and you see her all day at home. And I was like, well, it's not quite like that. I mean, like we're on opposites. Yeah, like I don't see her usually. But usually it's a case of like I'm going home, she's leaving. It's like, okay, high five, see you later, sort of thing. And then
here's kids.
and then so we really only see each other like in the evening, really, and then on the weekends. So which is tough in other ways too, especially with the childcare stuff. But
Yeah, exactly. I'd imagine you could probably align your schedules a bit more if childcare wasn't a thing. Like if you guys had,
Yeah, if they
and
were like
once the kids are
older.
both in school, I'm sure that'll adapt. And once they're a bit older and self-sufficient, like that'll probably adapt a bit. But yeah, you're in a
Totally.
phase where like the kids need constant care.
Yeah. Yeah, no, for sure. And like, uh, so it's not like we're not like swimming in each other's personal space like all the time, because that would be everybody. We all need we all need our own breaks from each other for sure. Well, part of the reason too we're on opposite schedule is that kind of going back to like the staffing thing. I mean, like trying to retain staff or attract new staff is tough as it is, and then people want to have like good schedules. And so like Kathy's kind of working evenings because like people don't want to work evenings, and Kathy's like, all right, well, frick, I guess I'm
Yeah,
doing it.
exactly.
So
And that's the plight of the owner is you
yeah,
pick up the scraps.
yeah. So we're kind of on opposite schedules because of that too.
Yeah.
Because we just got to make use of the clinic space and just being efficient with the time and their jam. We could still be better. We still need a few more people. And it makes it would be great to really kind of like boost up because we're not a big clinic. We just have 4 treatment rooms, and so usually it's kind of like we have like in a perfect world we'd have 3 physios on in the morning, 3 physios on in the evening, but
Yeah.
we don't quite have that right now.
Yeah.
But that would be ideal. But it's just it's tough for a multitude of reasons. So
Oh,
yeah,
totally. Well, and I want to talk about like this challenge of hiring physios and like kind of the shortage that we're in right now. And I mean, obviously, like I don't think anyone has the solution, but like, yeah, what like obviously it's been a challenge for every clinic owner, but like how would you describe the challenge of hiring physios? Like how would you, if you were to kind of like give an overview of what the entire like, landscape looks like right now, what is the landscape of hiring physios and practitioners like, and maybe specific to Victoria?
yeah. I mean, like so. I mean, it's probably the same thing in probably like a lot of like kind of not that Victoria's like a small city, but it's kind of like it's like a good small medium size.
Mm-hmm.
But yeah, I mean, traditionally it used to be a case where like there's more places hiring than there were physios or other clinicians looking for work. And so, but then like kind of during COVID and all the credentialing stuff, there was like it kind of shifted where there's actually a lot of people looking for work and places weren't hiring as much. So it was actually quite a different setting or landscape. So it was like, oh, okay, cool. Like actually we might have a good chance of like picking up some people now there were the two, but then slowly over the years, again, now it's kind of shifted back the other way where it's like, yeah, now there's definitely more clinics looking to hire. And so, so with the old, I guess the older way was like, some of these clinics would try to pick off people from other clinics, which was
Yes.
a bit, I don't believe in doing that. But it was a bit shisty for sure.
Yep.
And so,
Yep.
it's kind of like going back to that sort of thing there with the two, but I think people are kind of doing it in like different ways, being like, I've seen some clinics kind of post like, hey, are you looking for career change or just different culture or things like that, kind of give us a shout sort of thing, which is definitely more polite way to put it.
Yep.
And so I think there's a lot of that where you're just trying to really, and I was talking to this a little while ago with one of our physios that used to work with us about like, the use of social media is almost now more of a way to kind of like try to recruit talent than it is patients, because people are just like screaming, oh, hey, like what's this place like to work with, and like are people having fun here? Everybody's just kind of like very bland and
Totally. Because like, what's the point of trying to recruit clients if you don't have the practitioners to see them?
yeah, for sure. Yeah. So it's like, so it's just a case of like, you're trying to just like promote your clinic as like a cool place to be, sort of thing, is like the main one. And so I think we've kind of put like a little bit of like a hiring thing on pause for right now because we have a few other things we kind of want to work on. And we just want to make sure everybody's like schedules are totally solid and consistent. And so things have been like a little bit up and down. So we're just trying to work on some of that stuff first. But definitely it's you're just trying to draw people and kind of get their attention. But then the biggest thing is like once you start kind of getting in talks with them about like, well, at least what we have to offer is kind of what, like what the schedule would be ideally, pay and all those other sorts of things. It's tough because you're in a conversation with probably like 4 other clinics. And some of them are big and we're a smaller one. And so some clinics have a lot of like firepower behind them in terms of like what they can offer, and that's really hard to compete with. Is going back to the thing we were saying, we usually just had people kind of fall into our lap, and so like we've had people like interview us effectively,
Yes.
and because they're talking to some of their clinics, and then we leave the conversation be like, okay, sweet, yeah, I think we got them, and then no, they
Yeah.
we had like 1 year where we probably like interviewed like 3 or 4 people, and we all me and Kathy thought it went really well, and then they picked somewhere else, and it's like, oh, and like I think one of them was they picked because it was just like a closer proximity to where they were,
Yeah.
and then the other 2 people kind of they had a lot of like education allowance because one of the I don't know if you need to say who, but a lot of them they have like a lot of like a ton of mentorship stuff, and like they run courses and that sort of thing, so they just have like a lot of resources available to them, and I'm just like, I can't.
Yeah.
Our
Well, and that's just
education
it too.
allowance
Like,
is
it's such a values thing, like for what someone values. Like, yeah, does someone value being able to walk to work? Does someone value education? Does someone value
yeah,
culture? And it sounds like you've really like
yeah,
latched onto the culture aspect of it.
yeah,
Like, like ease of, collaboration and like a really happy, fun kind of space. Like, and I think that you just kind of have to like latch on to that, and then you can value that in someone else. If they don't value that in return, then maybe it isn't a great match. But yeah, when there's not an abundance of physios coming your way, it's not like we can be super selective.
yeah. Right, yeah, for sure. So you just really have to sell the small clinic vibe, and just make people feel like they're not just like a number and all sorts of things too. So I think it's
Totally.
just really trying to like push that part of it, and it's like you're trying to um and then like because everybody sees like the percentage of the dollar signs, and
Mm-hmm.
that's really appealing because some clinics are offering like crazy high percentage, and it's just like,
Oh
ooh,
my God.
um
I know, right?
can't
It's
can't be
wild.
that's going to ruin us all in the end,
Do you
sort of thing.
hire?
So it's like trying to get them to understand like, okay, like it's this, like it works up to this, and like if your caseload's
I know.
consistently busy, like that's going to ultimately be the main thing that's going to help you with generate the most income, as opposed to like
It's
having a high percentage and then you're patchy in your schedule.
exactly. Like, I would much rather be on a lower fee split and have a fully booked schedule than be on a higher fee split and see, 60% full days. Like, you're going to make more money at the lower fee split then, but people can't really see that. Do you hire as contractors or employees, or what's your model?
Yeah, so we actually, so when we opened the business, our our accountant was like, "Oh, how's it going to work for like? Are the people going to be working in other places, or are they just going to be working for you?" And we're like, "Well, classically, they're just going to be kind of working for us, but they might work somewhere else." And he's like, "Okay, well, if they're only working for you." He's like, my understanding is that like contractors, it really is like it's a common thing for physio, but like
Yeah.
if the CRA kind of like starts questioning you on things like, oh, they're not working anywhere else, oh, they're employee, oh, you haven't been
Yeah.
paying CPP and EI, and then they're gonna
Yeah.
kind of make you back pay all that sort of stuff. And so our accountant was like, you got to make them employees if
Yeah.
you can. And then our lawyer was just like, oh, well, industry standard is contractors, so you should just make them contractors. And we're like, okay.
Right. But it's
So
the
yeah,
CRA who's going to charge you.
yeah, exactly. Yeah. And so we're like, okay, well, I think we're going to do the employee route because I think what our accountant was kind of saying was a good, safe call.
Yes.
And so, like, our lawyer is good, but our accountant kind of understood things, I think, from our industry, like a little bit more.
And the
But
CRA is cracking down on a lot of these
yes, that
models. Like,
too.
they are
Yes.
auditing it. So,
So it was lucky that we ended up kind of having that conversation with our accountants, and they're great. And so he was just trying to push that one, and we're just like, oh, like, 'cause I don't even know how to do that. And so then I don't know how we found out about it, but there's a clinic in town here, and we heard that they were kind of doing like commission based employees.
yes. Yeah.
And so we're just like, oh, okay, like so this is actually being done. We just didn't know. And so then
Mm-hmm.
we contacted the owner there. His name's Paul, and he's great. And he gave us a lot of time over the phone one day. Like we probably chatted his ear off for like an hour and a half, just like questioning stuff on like, how does
Wow.
this work? Like, are people happy with it? Are people like upset? Like, are they hear things from other people? Like, oh, I'm not making that much money because I'm doing this and
Yeah.
that sort of thing. And so that is like how it works. And so like, um, he just kind of gave us like the foundation. And then we went back to the lawyer and paid the big bucks to get the old contract written up.
Oh, yeah.
Yeah, but we had like the stuff in it that we kind of wanted. At least we had some kind of like framework to kind of work off, which was helpful. So there was a lot of like time and money kind of put into kind of making that. But looking back on it now, we're just like, holy crap! I'm so glad we did that. So most of our physios are employees because it's a lower. Oh, and it's always hard to explain how this works to people too, because they just think like, oh, percentage fee split. And I said, well, there's that, and then there's these other things to kind of top it up and kind of balance it out, sort of thing. But it's the case of like, yeah, like you have like your base fee split, which is lower, but then you get like education allowance, and we have a small like health benefits plan for the clinic too, and then we cover like work safe stuff and CPP and all those other things there with as well. So like in the end, it actually ends up kind of working out to be equivocal, maybe even better.
Yes.
But it's hard to explain that to people. And I'm not the financial literate guy. Kathy should be here.
We'll get Kathy on the podcast and we can chat more about that with her.
Things I haven't said wrong. Let me go again from scratch. And so we just kind of went through all that sort of stuff with people. And I think some people were kind of like turned off going back to all the interviews and stuff we have with people, because I know like this doesn't really kind of make much sense. But in the end, I'm glad we kind of did that sort of stuff, and it's just it does kind of like safeguard us a bit, and it kind of like, not that you want to have like control over people and how they work, but it kind of gives you like a little more, I guess, power to some extent to kind of be like, hey, like this is what we need to do, like this is kind of like how things are, and then you kind of implement it. And obviously you want to make sure everybody's like consents to those changes and they're cool with how things are, but it kind of gives you like a little more kind of control over things.
Yeah.
And then we have a couple of physios that are contract because they that's just what they wanted to do, and they paid out of their own pocket into like the health plan that we have there with it too. And so they just wanted to do it that way. So and we can't we try to explain to them, like the risk benefits of that sort of stuff. There were the two for everybody. And at the end of the day, they still wanted to do it. So okay, cool. As long as they understand what the differences are, and they do, and that's fine. So I don't think they're the type of people too, who are kind of going, obviously into the insurance stuff and the ICBs and all those sorts of things. Like if something was to happen, they're definitely the type of people where they understand, and they're intellectual and they're emotionally intelligent. They have a really good sense of how it works. Where I don't think it would be a case. Man, you never know, but I really doubt it'd be a case where they would try to be like, "Oh no, you guys said this, so like I'm off the hook, and it's all on you guys." And
and that's where you just have really great contracts in place with all your indemnity clauses and all that good stuff, because you have to protect yourself. But I think I think you're right. Like, and this is the problem with the commissioned employee versus like contractor model, is the commissioned employee always looks like it's a lower pay. But the thing is, it's like, just because you're making or taking home 65% doesn't mean you're actually keeping 65%, because by the time you pay your taxes after all of that, like like you're actually probably only going to take 40 something home after you pay your taxes, your CPP, your EI, and do all of that at the end of the year. And if you're not paying that as a contractor, you're going to be in big trouble when the CRA comes knocking on your door. So at the end of the day, like, I like, having been a contractor at all the clinics that I worked at prior to working for myself, it's such an easy way for the clinic to just like, it's just easier for them. Right. But at the end of the day, like, all that work falls back on the physio. But like, if I'm working, like, what used to frustrate me is like, I had to ask for time off. I had to, like, I was only allowed to work certain shifts because the room was only available at certain times. If I wanted to put more than like half an hour worth of break into my schedule, I had to get it approved. And I'm like, hold on a minute. I'm the business owner here. I'm the contractor. So you're paying me like a contractor. I'm paying my own taxes. I'm doing all my own things, but you are completely treating me like an employee. Like, if I'm a contractor, I tell you when I'm working. You don't tell me when I'm working. It's the other way around. And like, I was supposed to have a couple little things of my own, like equipment, but like that wasn't really, there's kind of the like stress test for a contractor. Like, do you have control over your schedule? Do you have your own assets? Do you have risk? So in the true contractor model, there should be a rent involved with it. They should own some of their own stuff. They should have full control over their schedule. They should be marketing for themselves. This is another really big one, is like, contractors will often depend on the clinic for marketing, but the clinic should not. Like, when that is the case, you are responsible for getting the clients, like, unless it's like a proper, like, I've subcontracted you because I have an abundance of work and, blah, blah, blah. Like, there's all these like technicalities that come with it. but marketing is the responsibility of the business owner. So at the end of the day, the way it really truly should look is if you're a contractor, you pay a clinic for use of their space and bring your own clients in. And that is not the way traditionally clinics have done it. So I think you've like obviously done your due diligence and done your research and like figured out the best way that works for you for the business that you've built.
Yeah, for sure. And I think with all that sort of stuff too, I mean, yeah, we kind of like, we're a bit too nice with things.
And physios generally
and
are.
Because, we're
Right?
just nice, and because it's all that thing too, where it's like, well, we don't really want to mess with like, you know, the vibe in the clinic where if you start looking kind of like stingy, or even if you're not being, but it kind of looks, you're kind of giving that impression, and then like you just don't want to risk like losing some really great people, so like you kind of like in the roles a little bit.
And this is where the whole like hiring of physios, like this is like all such a like intermix right now, right? Because it's super hard to hire physios because there's an abundance of clinics, especially in the Lower Mainland. Like in Vancouver, there's so many clinics. There's 2 clinics on every block, and so there's too many clinics for how many physios there are. And so some owners are giving these like ridiculous splits. So someone's like, well, oh, you're going to like take a benefit away from me or like take a perk away from me. I'm just going to go down the road where I'm going to actually go get 80%, and they're going to walk away. And so it's like, we do have to be flexible to an extent, but at the same time, like, that's just like, it just like compounds the problem, right? Like everyone needs to be on the same page, which is why I'm like such a big advocate for like, everyone needs to be like listening to what PABC is saying. And like why I want to have the podcast is like kind of get the understanding of what's happening to business owners and clinic owners right now in the province as a whole out there, so that we can all be on the same page.
Absolutely.
It's frustrating. I get real fired up when I talk about it.
Yeah, because like with anything in life, consistency is key. Steady message.
Yes.
Instead of ambiguity and chaos, whatever. Yeah.
Totally. Well, and then couple all that too with like the cost of everything is like so much higher. And yet we've only really increased our rates, like the customary, like inflationary, couple dollars a year right now. So like, obviously you guys have done some amazing like work and research, and buying the facility is like huge. The fact that was like the foresight that you guys had there was amazing. But like now, yeah, you're right. All these mortgage rates, all these leases have gone up massively. And now we have people who are paying so much more in rent. Like the cost, like I bought one of the like Sears, like 3-piece plinths a few years ago. I think I bought it like end of 2019. And I think with delivery, it was about $3,000. I'm seeing them used for $3,000 right now. Like, and that was like not with delivery, not with anything like, and to buy them brand new, like you're looking at like $4,000 plus shipping. Like that's not 2% inflation. Yes, I am not a mathematician, but that's not customary inflation. That's like a massive jump.
Yeah, I know for sure. And I think like a lot of places are just kind of like charging it because they can as well too, I'm sure, is part of it.
Yes.
The components have really not changed that much.
Right? And like, sure, like, yeah, like
everybody's, yeah.
And like shipping, yes, like, we've had massive delays in shipping and all of that. Like, things have changed. I understand that. But yeah, you're right. I think a lot of places are charging what they are because they can.
Yeah, for sure.
So and that's the reality of it right now, is like clinic owners are having to be more generous on top of having these like rising costs in order to maintain staff. And it's, so I think you're right. Like you have to offer something else, whether that's culture or education or benefits, or, like there has to be something else in that package in order to maintain physios. And physios also, like the practitioners need to understand the realities of it too, because I think so, like as a practitioner myself, I didn't understand what it was like to, I went and did all this training and was like, I want more money now because I'm higher trained. I just took my needling. I just took PDTR. Like I want more money. And I don't think I truly understood, and this was all pre-COVID too, but like I did not understand the realities of owning a clinic. And now that I do, I'm like, there's so much more expenses than I ever could have dreamed.
Yeah. Oh, for sure. Yeah. Absolutely. And like I was saying, like kind of being there too, like we're still not quite at a point where we thought we would be, this because we had like this, and we thought we were being cautious. Like we were kind of writing out like business plan, like projected income and all that sort of stuff. And looking back on it now, it's just like, man, was I like high as a kite when I wrote this thing? Like what are these numbers? Like I'm in dreamland. Totally dreamland.
Wow. And
And so, I
that's
mean, and
like,
we were being, yeah, I thought we were being kind of cautious with it, but I think we were being overly optimistic with maybe how many clinicians that we had and
yeah. But
that
how
sort of
were we
stuff
to
too. But
know? And like, this is the other
yeah,
piece too, is like, in COVID, we also had the licensing issues. Like the exam fell apart. So we lost that. The examinations are a completely different process. And we no longer have interim licenses. So anyone coming
mm,
internationally can't work for X amount of months because there's no interim license. So they can't work until they're fully registered. And we know that the gap between writing the exam and then being registered is usually several months. So if I'm trained in Australia, why am I going to come to BC and sit around for 10 months while I wait for my
totally.
license? I'm going to go work in Ontario or Alberta or wherever else
Hmm.
where I can actually get to work right away as an interim. So losing that has significantly hurt clinic owners and the hiring process because now so many of them are going elsewhere. And the hope is that they eventually do come back, but a lot of them
Hmm.
go and they get happy and they maybe they meet a partner and have a family, or they start a clinic there, or they end up staying in these places. So we're really pushing away candidates right now because of this
Hmm.
not having the interim license, and the whole like licensing process has really deterred people from moving to BC. So
Hmm.
yeah, it's like a total like intersection of difficulty to own a clinic right now.
For sure, yeah. And then of course, like it seemed like BC pays pretty high fee split. I remember it was. I mean, this would have been a long time ago, but like in Ontario, I remember I think the fee split. This is like 2012. Like you'd be starting at like 25-30%. Like
Really?
yeah, pretty low. Or you're just like we were paid like hourly.
Yeah.
Yeah, it wasn't that great, but you're just new grad. You're like, oh, girl, I'm making money now, and
I
I'm
got a
doing
job.
a job. Woo. Yeah, and then, but like, yeah, and then out here, like, when we moved out here like, a couple of years later, I'm just like, wow, like it started at 50%. Like I was like, and so like,
Yeah.
because out there, we had friends that were doing like 35. I'm like, oh wow, you guys are like rolling in it. And but so out here, it's just like wow, like 50%, like that's pretty high, and it obviously just kind of goes up from there too. So
Wow.
it's like, yeah, there's a lot of things going on. Like you said, there's like just trying to retain
Wow.
people and have people to come to you and
Wow.
pay higher
Wow.
wage and then have a lower group of people to pick from. And yeah, oh yeah,
Yeah. That's interesting.
yeah.
Yeah, I mean, I'm sure we could go on and just like whine and complain about the
Oh, I could
about
not
the
want to
current
stop
state.
myself.
But but I also think you've done some really really cool things. The other thing I want to talk about, because I this like jumped out at me when you mentioned it, is you have a certified green business in
Mhm.
Victoria, which is like really really cool, and another like cool perk for a physio who wants to come over to be like, hey, like I work for this business that's like fully green certified. So first of all, what does that mean and how do you get there?
No, that's a good question. So when we were kind of in the process of kind of putting the clinic together, I mean, yeah, we're both environmentally pretty conscious as it is,
Mm,
just with like kind of home life stuff. I mean, we try to recycle everything we can and kind of reduce waste and stuff like that. And but kind of works to our detriment because we're like stockpiling like soft plastic and like foil plastic, and our place looks like crap.
yeah.
Anyway, so we just try to like reduce like the impact on the landfill and all these other sorts of things. And so we kind of carried some of that over into the business stuff. Where it's like, what can we do to, because there's so much waste in healthcare. I can't remember how many tons of stuff gets kind of tossed out. And so we're
Mhm.
just like, in all good conscience, like we can't do it. And then also too, like we're in an area called Dockside Green, and so that's another kind of like push because like that's designed about being like a walkable community and sustainable and renewable energy kind of use and that sort of thing as well. So we just really wanted to kind of do it right off the bat. So we were kind of looking at what was out there, and I just happened to kind of stumble across it. At the time, it was called the Vancouver Island Green Business Collective, and they hadn't been around for too long. They're kind of like a nonprofit arm of another group called like Synergy
Mm,
Enterprises, I think. And so they had this. There wasn't many kind of businesses kind of certified at the time, but they were pretty
mhm.
much they would just kind of have this like checklist that you go through. They'd come and do like an on-site visit to kind of see like you're like, oh yeah, what kind of things do you have in place? Like, what are you using for like paper? Like, are you using like 100% recycled material paper? You know, what do you use? Are your product or your like electronics like Energy Star certified? Like how much like water do you use? Like do you have like the the regulators on the tap so you're not just like gushing water out? And all these sorts of things. And so they kind of, just kind of came around, kind of looked at the clinic, LED lights and all that sort of stuff. And so um, they, so they had like their kind of list of criteria. And then like with that, they also had like Surfrider Canada. They had like another kind of certification for that too, which was pretty easy to get because like the clinic had just been like built, so it had like all the modern stuff in it to begin with. And we were able to kind of say like, oh hey, like I want this here, and like I want a low flush toilet and all those sorts of things. So that was really easy for us to do because we kind of started from scratch. And so
and clearly something that you value yourselves anyway, so probably would have done regardless.
Yeah, for sure. Yeah, so it was just like it was just like a no-brainer to kind of go that route. And so then so at the time I think we were like like from what I understood we were like the only health clinic I think like on their system or whatever. Definitely only kind of like physio clinic for sure. And so so we kind of, I think we got an award that year for most greenest office and things like that too. And so that was cool. So that was kind of neat to kind of get our name out a little bit into the community that way as well. Because it wasn't like a huge patient draw, but they would have like people come in and be like, "Oh, that's sweet! Like, I didn't even know you guys could like do that." And so, because we had there's a company called TerraCycle that and they're based out of California, but like we have like like glove recycling. Like you just like chuck it into this bin and they just like take it away, and none of it goes in the garbage. And we got really kind of like nit gritty. Like we made our own flannel cotton swabs, I guess you could say.
Oh my god!
So we just have these like little squares of like flannel that we stitched, and we just kind of use those instead of like throwing cotton balls into the garbage. And so we just chuck them into this bag. You just like put in the washing machine.
Oh my god!
So, and we have like a digital fax. So there's no paper used on that. Out of a company out of Nanaimo. What else do we kind of have in place here with it too? Just trying to just do is like just kind of as much renewable stuff as we can, and I think we do okay with that for sure. And there's like since that there's been like a few other clinics that have kind of got on board in the city too now that I kind of know that are kind of listed, which is great. So now it's kind of actually turning into a bit of a competition because it's all based on points. It's just like, oh, how many? I got 50 points this year, sort of thing. But like some of it gets a bit like crazy in terms of like stuff you have to do, and there's some things that we'll just never really be able to do because of the logistics behind it.
Well, and there's just certain things like like if you're doing pelvic floor physio or if you're needling, like you're gonna go through gloves. Like there's just like something it's just something that's going to happen. And and every time you open a an acupuncture, like a dry needle, it's like wrapped in plastic, and like those are the kinds of things that like short of just not offering those services, like you're never gonna skirt around those things. But for the most part, like as much minimizing as much as possible, and having like more the like water, electricity, like the big things, I think those are like probably pretty achievable for most clinics.
For sure.
And like emailing receipts instead of printing them.
Totally. Yeah, absolutely. And so I think there's already like a lot of good things in place that you just tend to take advantage of, and like a lot of stuff isn't really that expensive. The glove boxes are a little pricey, and I'm sure they've gone up too. Like they could be like, sometimes you can catch them on a sale, but otherwise they could be like $350, $400, which is a lot.
Yeah.
But like it's heavy. Like we stuff the crap out of those. Probably more than we should, because like the poor person that has to come from like UPS or whoever to kind of pick that thing up. Like the shipping's all taken care of too in that price, so that's obviously then turning it into other material, like other kind of like forms of like plastic and stuff like that to use in other things. I get why they charge that much, because it's definitely quite a process, but it's probably mostly shipping something that weighs
a lot,
50, 60 pounds by the time you're done. Like, and it's got
that's wild, because that's just like gloves.
Huh?
That's literally just gloves.
It's gloves. Oh yeah. I think you put like 3,600 gloves in a box, and I think we probably crammed like 5,000. I don't know. We shoved the heck out of them.
Yeah. Well, and that must be like a year's worth of gloves.
Oh yeah, for sure. Like and then we have like two, like one on each end of the clinic. They're with it as well, so they usually get about a year out of it. So I know some people are saying, "Oh man, it's pretty expensive," and I was like, "Yeah, but like it's in the grand scheme of things, it's."
That's
like $2 a day or whatever, but yeah.
You're gonna go through more garbage bags. like you're going to pay just as much in garbage bags, like if
Yeah,
you're
that's
just
a good way to
constantly
look at
throwing
it.
them in the garbage, right? So you're, and you're damaging the environment doing it that way too. So
Yeah.
yeah, like I think it's a win-win all around. Like yeah, I'm all
Yeah,
for
for
it.
sure.
I'm very good at justifying these things.
Yeah. Thank you for backing my thoughts up too. And then
Totally.
yeah, then
Well,
with COVID, we had like the mask
oh
recycling
yeah.
as well, because that was a big one. It's freaking finding masks all over the place, and
Oh my
we
God.
had like a
What a
therapy
mess
appointment
they
too
made.
and stuff. And, yeah,
Yeah, like what an absolute mess they made. Like
yeah,
that's just gross. I want to talk a bit more about your role. So I know you have been really involved with the ortho division. And I really want to know, like you just went to Ortho Symposium. I want to know a bit more about your role there and like how it affects your practice, but also like talking a bit about, I know that they've talked a bit about advanced practice and what that looks like scope of practice wise. So tell me a bit about your like role with ortho, like with ortho division.
yeah. So so I got my F camp in 2019,
Nice.
and
Congrats.
hmm?
Congrats.
Oh, thank you. Yeah, yeah.
It's a long process.
Snuck it in there before the second kid showed up. And so yeah, so I mean yeah, so I've kind of done like a lot of like the ortho levels, and I mean I would have loved to have done like the Western program. It just wasn't feasible for me to fly out there, and obviously all those other sorts of things. But they have a really solid program there. So I went through like the ortho div, did have part of the levels in Ontario, part of the levels out here, which was kind of cool to kind of see the different
Mm.
kind of approaches to things. So there definitely is, which is kind of neat. So, but yeah, so I've kind of know about all the different kind of level structures and that sort of things, and things have changed over the years in a good way too, which is great. But
Mm.
I just kind of saw something pop up. I don't even know where I saw that now. I might have been through a PABC thing potentially, but I'm not sure. But yeah, they just wanted like an FCAM kind of member at large sort of thing to kind of join the exec, and so because the BC section had kind of been like kind of creeping along, not doing too much, and I think it was mostly kind of like it was mostly run by kind of like two people. So we kind of like the chair, and then Kaylee, who's great, who kind of runs all like the course stuff and organization, and does a ton of work kind of behind the scenes, and then yeah, Patrick was the chair, and so like so I just kind of joined them, and then Patrick got into the Western program, and so they said, "Oh, I'm going to Ontario," and then who wants to be chair, and then like nothing was happening. I'm just like, I'll do it. And so because I mean, I guess like I kind of got involved with it in the first place. Sorry, I shouldn't have made that look so reluctant.
No.
It's not. But I just
Well, you
kind
had
of
a lot on your plate. You've had a lot on your plate.
I just like, oh, am I going to screw myself by taking on? I'm a yes person. That's a problem of mine. But I just wanted to kind of like just get in there because I just really was like, oh man, like the ortho div stuff is great, and I feel like it's maybe a little out of touch in some cases, and so I mean I had some ideas that I just wanted to say like, hey, can we just make some changes and make it relevant for people that there's and just kind of like show that there's like a ton of value, because I think these days, like I think a lot of like the stuff that's kind of come out there you see online is just like, oh, like manual therapy is crap and it doesn't do anything, and it's like, why are you wasting your time with that? And there's some of that, because you can obviously kind of dive off the deep end into a lot of things and drink the Kool-Aid and think there's only one way of doing stuff, and so
Yes.
I get where people are kind of coming from with that, but there's
certainly
lots of
fallen
value
victim
in
to
the
that
ortho
too.
levels. Pardon me?
Yeah. Oh, I've certainly fallen victim to the like, once you do one thing, you drink the Kool-Aid and you're in, and yes.
You got the hammer and everything's nails. Yeah.
Yes. Yeah.
And so I just kind of wanted to be involved, just because I mean there's a lot of value in the manual therapy stuff, and I think a lot of the stuff is good. Like, I mean, I usually people ask me, I'm like, well, at least, I mean, it would be good to kind of at least kind of get up and do like your intermediate exam. If you don't want to go past that, that's totally cool. But there's a lot of really good stuff in it that's really valuable to have, and tips and tricks and that sort of thing. So I just wanted to just kind of get involved, just kind of see like, hey, can we just get this thing up and running again, and maybe make some suggestions myself along the way there with it too. And so when I kind of stepped into kind of like the chair role, which I guess fumbled my way in, then we had our co-chair that is with me, Matt, who's great. Him and Patrick are very well connected. I feel kind of like the odd guy out, where it's just like, I know some people, but you guys know like way more. Like, should I even be in the chair? Like, what the heck's going on here? Sort of thing. And so, but you surround yourself with good people. You don't have to know obviously everything. And so definitely there's some great
you can lean on them. Yeah.
too. And so, this is the case of just like trying to just get things, like up and running and just kind of get the word out. And, just, my biggest thing was I wanted to get in there and just kind of like show the value of it or help show the value of it. And like, just be like, hey, like, like there's lots of courses out there. Like I felt like there was only like, people just think of like the ortho levels and some people find it's kind of like boring or like irrelevant. And it's like, well, there's other courses and stuff too. Like we have like amazing clinicians out here that have a lot of knowledge that they can kind of share. And so we're just like, oh, like maybe we can get other courses kind of up and running too. And just kind of, kind of take like the main like AIM curriculum, but then kind of like supplement it with this other stuff to kind of, build it out a bit more, because there's just so many other courses and companies out there like kind of like coming out from the States that are kind of offering things, and like they have some really good stuff too, but like we can do this at home too as well, go Canada.
Yeah, totally. And I know PABC's on the same time, like the same brainwave too, so I think it's really cool to be pumping more Canadian and local courses.
Yeah, absolutely. And so I think it's this case where, just want to get the word out more about like what it has to kind of offer, and just again, to kind of show there's value. I mean, you can't just, just throw all that stuff away. But also to like see if there's a way to kind of like, just kind of like update things a bit, maybe kind of draw people in and get them more involved, and just kind of build out like that community, because I feel like it's just like this kind of disconnect between like, oh, like Ortho Div members, and then like, okay, we have this exact, but like, what do we do, and like, what are we getting out of this, and that sort of thing as well. So now we have an Ortho Div email address, so people can kind of reach out to us directly. It'll come into my inbox, and I can spread the word anywhere too, so people can actually reach us now, which is great.
Wow. Oh, that wasn't a thing before. Got it. Okay.
No, yeah. And so with the at the symposium meeting, we had like, there was like a chairs meeting from across the country sort of thing. So it was actually cool to kind of meet and see everybody, which is great. And like, I think, in terms of, what the CPA, like the National Orthopedic Division, are trying to do, I think they're on it. They're making some good changes. They're being fiscally responsible. They're trying to get more feedback and just really get a good understanding of like where people are coming from, like who's taking courses, or how far are they having to travel, what is it there to kind of like out there to offer. They're just trying to gain a lot of data pretty much, and just figure out like expenses.
Well, and like I've never gone through the ortho levels. Like I took my level 1 exam while I was still in school, just because we could. And then I went into acupuncture, and then down kind of like the functional neurology, like neurokinetic therapy, proprioceptive deep tendon reflex. Like I went down like more of a neuro route. And it's interesting because I like initially the barrier for me was just cost and time. Like I was like, I just need to get some reps in. And, some of the courses that I took were, and having taken acupuncture, that was a long thing. So it was like one or the other. And so it's interesting because now it's not something that's really been on my radar, because of obviously like going now more down like the business route. But now that you're even talking about it, I'm like, oh, it's interesting. Like I'm curious to know, a little bit more about it. But like the big barrier for me new out of school was like the time dedication and the cost of it. So I'm curious to know like if that shifted at all, or like what the landscape looks like there now.
I think like the cost, they've been pretty good at trying to keep costs in check with things, but again, it's like classic physio world issue where it's like, you're doing it on your own time, probably on the weekends, because stuff's not really being run during the week, because then people have to take time off and lose money from that. So either way, you're losing money in some shape or form. So there's that issue.
You're not working and you're paying to be there.
Yeah, totally. So there's that, where usually physicians, they like get paid to go places, and that's just kind of standard. And so like there's a bit of like a culture or like industry shift that needs to kind of happen on that too. But the biggest thing, like, Canada's like, we're a huge country. And so like, courses are usually offered in like some on the island, mostly lower mainland, maybe sprinkling in the Okanagan here and there. But they just, like, people are just like, I can't drive 6 hours for a course. And so they're just trying to figure out ways of like, hey, like, how can we do like different kinds of offerings? Like maybe people are willing to travel, and we can kind of like clinicians are, and we can compensate them for it, or if we can kind of do more like online kind of mixed model sort of stuff too, which has already been kind of happening a little bit. But yeah, they're just definitely trying to like change stuff, and they're also trying to change like wording around things, and DEI and just like kind of cultural safety, and they're trying to change like a lot of like the language stuff there with it too, about how things are
Oh, interesting.
being expressed and communicated there with it too. Not that they were doing a bad job before, but like they changed some of the names and some of the roles so that it sounds a little less colonial,
Yeah,
doing things. So they're
that'd be
very,
great.
yeah, I think there's going to be some really good stuff that's going to be kind of coming up.
Cool. Well, I'll have to be watching a little
Yeah.
bit more because it's actually very intriguing to me. Like, yeah,
Yeah.
like it just wasn't a path that I found myself on, and found other things that were really intriguing and interesting to me and kind of went down that road. But now that
Cool.
I'm
Sure.
like,
Yeah.
huh, okay, I'm gonna have to
Yeah.
check it out a little bit. And I mean, like as a profession, we're talking a lot about like scope of practice and advanced practice. Is that
Mhm.
something that is on in the conversation with ortho as
Yeah.
well, or where's that at?
So there was like Alison Russian, who's she's from the UK, but she's at Western. Seems like all the big names are Western. Everybody's like, oh,
Yeah,
you're Western. Oh, here comes Western. Yeah.
yeah,
So, but they just have like a really good team there. They're just very fortunate, and obviously they're a highly regarded school, so I think people kind of flock there also
yeah,
as well. But yeah, Alison Russian kind of did a big presentation on it, and there was other kind of like little kind of mini presentations too about advanced practice physio, and so I think that's a big focus of the CPA
yeah.
now too, because it's just like, yeah, I mean, it kind of like it builds into kind of trying to like advance the profession forwards, but also having to change, like you got to change the scope first before you can do the other things. So there's just like there's a
Yeah,
lot
like
of stuff.
why do all the training if you can't, order an ultrasound?
Yeah, totally. So I think it's a case where it's like right now, like they're trying to figure out, okay, how do we get to APP or advanced practice physio? Like, how do we get to that point? Like we know what it looks like in a lot of cases because they've kind of done like a lot of research and stuff like that in other countries. Like UK is like a really good example
Yes, yeah.
of like, okay, like what are the core competencies? I think Western has some of that built into their programs too. Like, what are the core competencies? Like, what do people need for like an education to be able to be advanced practice physio? And like, what is this going to look like down the road? Okay, we need to do these things first. We got to like change scope and yeah, get the imaging rates and maybe injections in certain cases
Yeah,
with it too.
yeah.
So like that's actually definitely like a big focus for them because I think they're, and rightfully so. I mean, and this is nothing new either. Like, physios were a pretty powerful group. We have a lot to offer, and we're kind of underutilized in a
I
lot
would
of
agree.
ways.
Yeah.
So like like having physio in like the emerge room, and I know they've been kind of playing around with a little bit there too.
Hmm.
Like that's huge that you can offload the doctors' chaos that they have to kind of
Yeah,
deal because a lot of people do come in with MSK
yeah.
issues because
Well, it's
something's
interesting because
happened.
I here in Kamloops
Yeah,
now have started working with interior health. I told you earlier, but I'm
hmm
working in the urgent care centers. So what they're
yeah,
doing
yeah.
is when they're calling, anything ortho is getting booked in with physio, which is then offloading the doctors in urgent care, which is then
Hmm.
in turn hopefully offloading the doctors in emerge, which is really really amazing. But the thing is a lot of people don't even know this exists, let
Hmm.
alone like I think obviously it exists in Kamloops. I believe it exists in Lower Mainland. I know they have one in Kelowna where they have physio, but there's not a lot of physios working in that setting. And I think a huge part of us advocating for higher rates and like expanded scope of practice and all these things also has the conversation also has to have like better access to physio in the public system too. I think because now
Hmm.
we're going to be charging more at the insurance level and copay, and all the people who don't have benefits also need to be able to access physio in a more affordable way. So I think like the urgent care emerge model also needs to go hand in hand with that conversation. So like, and that's where advanced practice, like physios will be more inclined to want to work in that setting if they feel like they actually have the autonomy to be able to order some of these things or do the interventions that are actually going to take the load off of the doctor. Because if I assess someone and they still need to go get an ultrasound or they still need to get an injection or prolo or like whatever,
Yeah,
um, it's still going to end up back on the doctor's plate. So we need to make working in the public system with these resources more
yeah,
appealing to physios if we are going
yeah.
to be talking about a private jump too.
And like, how's it been working for you so far? Like,
I'm brand new
yeah.
to it, but I am really enjoying it. It's really great. And I think for me, like I was pretty burnt out, like when I left practice to run the business, and I was pretty tired. And so what I really like about it is like you can assess something and then you're kind of like redistributing it or like re-triaging it. Like, is it actually something that can be handled in the community? Great, send it back to private physio. And what I've learned is a lot of people don't even understand, like a lot of the public don't understand that A, you don't need a note to go see physio, and B, physios are capable of assessing. Like, I think there's a lot of lack of education in the public and just the community that physios are primary, like we totally take it for granted. Like, we know this, but a lot of people think they need to go see a doctor first for something orthopedic and then get referred to a physio. So I think that falls on us as a profession and also on our association for educating the public that we are, and I think, the public, like the government has a responsibility there. If they want to offload doctors, they need to educate the public that physiotherapists are a viable option. And so, like, I think there's a lot of things that need to change in order to change the public perception of our profession. But in order to do that, we also need to have these expanded scopes and to have, to feel like we're getting, like, the thing is like, no one wants to take the time and leave their practice to do advocacy work when they don't get paid. Like, if we're getting paid quality money and feeling valued, yeah, we might actually take the time to do better education and more public awareness campaigns. But the problem is like a lot of physios and a lot of clinic owners, as we know, are really struggling to just survive. So they can't take a break from practice or from running their clinic to do this education work that is so deeply required. So it's just, we stay stuck in these patterns and the public doesn't fully understand. And so anyway, there's a lot that needs to change. I'm really happy with the work that PABC is doing right now. Like, it's amazing. I said to Sean Cranberry over the weekend, I said to him, I was like, I feel like I'm, after being a member for like 11, 12, 13 years, I don't know, since I started school, I feel like I'm finally getting my money's worth. Like, it actually feels really, really cool. And like, people like yourself, you want to be involved. You want to be the chair. You want to be involved with PABC. Like, it is so neat to see this. Like it always kind of felt like it was like the older physios who were maybe like had been physios for a long time and they were kind of tired and needed something else to do. That was kind of my perception of it when I was like starting. But it feels like there's this like younger generation of physios who are like, no, I didn't go into this job to be living on the poverty line. And paying my staff wages that are going to keep them on the poverty line. Especially admin staff. Like, it's just like, no, something's got to change. And part of that is going to take this like multifaceted approach to getting the public perception of physio more elevated to what we actually can offer.
Yeah, no, for sure. So I think, like you said, there's a lot of pieces in that.
Sorry, that was my tangent. That was my rant.
That's all good. No, but there's this, there's a lot of, there's public perception. There's like, obviously like physician or anybody else in that kind of world too, where it's just like, their view of like what physio is and what we can do, and maybe ego in the mix as well and things. Cause I mean, like I have a buddy who just finished his psychiatry residency, and so I've been to some of his like cohort, I guess, like parties and stuff like that too. And I'm like, oh man, these new physicians are sweet. Like, they're just like, not that you can't have like good older physicians too. Like, there's some gems out there for sure. But I feel like that with even just going to some of these gatherings or whatever, and it's like, oh, you're physio. I was like, oh yeah. And then it's like, oh good. He's just like, if somebody comes into me and says that like something hurts, like, I don't know what to do. I just say, don't, just go see physio. Like, they will give you way more time than I can, and they'll be more thorough. Like, I don't even try. Like, I just say, don't, just go see physio. They'll handle it for you, sort of thing. And I'm just like, okay, cool. So like, there's that's kind of happening too. And so I mean, I think it's obviously been happening over recent years there with it, but I think that's like a big part of it is like, physician awareness. And it's I can't remember
when clients trust referrals from their doctors. Like, when it's a doctor saying, go see a physiotherapist, they're going to trust that more than like Googling it,
For sure.
Or like,
And on the flip side too, we'll have ones that'll be like, oh, I've had patients, oh, should I do physio? And the doctor's just like, don't waste your money on that. And it's just like, excuse me.
Thanks for totally slandering the entire profession.
And so I think, and then, I mean, if that just kind of keeps getting passed down through patients and stuff too, like, that's not gonna help anything. So, I shouldn't just be picking on the physicians. I mean, it happens, and we all kind of do it. Like we all think
Oh,
we're
totally. And we have
best.
our own biases and all that stuff. But yeah, I mean, it's like, yeah, we gotta like know where, the good referrals are coming from, and like, who's talking shit in the professions. And
Yeah. Oh, for sure. Yeah. So I think it's just like, yeah, there's that. There's like, yeah, other healthcare providers' views, public views, government
yeah.
stuff in terms
Oh,
of like how we're
100%.
being portrayed and our role. Because yeah, and then of course, and then relaying all that stuff up into like the insurers, because if everybody's just like, doctors are saying we have value, our patients are saying we have value, all these other associations are saying we have value, and then the insurance companies, you would hope, would take that information and be like, okay, maybe we'll pay more. But I don't think
And
that's going
that's
to
the
necessarily
battle we
happen,
keep
because
fighting.
somebody needs to press on them to
Yeah.
do something, which is why I think that comes down to the PABC and just kind of being strong and supportive.
Yeah. And I know that's big time on the radar. Obviously, they've been fighting Pacific Blue Cross. They're currently fighting ICBC right now. So I know it's happening. And that's why I have so much faith and trust in them right now, which is like, is really cool. So yeah, with our last couple of minutes, what I would love to, a question that I've been asking everyone, because the name of the podcast is The Health of Business. I want to know, what's a healthy business to you? Like, what's a healthy business life? What's a healthy business look like to you?
I mean, I'd say a healthy business is, well, I mean, obviously, I mean, everybody's going to say like, well, you're generating enough income to kind of like pay yourself and your staff. But I mean, I think kind of like, I mean, underneath all that, I mean, if you can get a business that has, going back to like a good, strong kind of culture, people are happy to be there, they're engaged in what they're doing. And that goes for like your front desk staff too, because they are so important.
Well, they're the first people that your patients see in the whole, pathway that the clients and the patients, like, they're the first point of contact. So that's huge.
For sure. Yeah. So I think you could almost even say, like, if your front desk are happy and in a good mood, then that kind of shows what's going on in the background behind them. So like, and if they're in a good mood, they're, portraying good positive vibes to the people that are coming in. And so I think they're almost kind of like your barometer of like how things are going. Because if they're looking stressed and they're grumpy and they're just like, no, then like that just kind of shows like, hey, what the hell, like what's going on here? And I think we've probably all done that too, where you've gone into a store, you're just like, what the hell kind of
something's up? There's a palpable energy. I don't know what it is, but something is up. Yeah,
for sure. So I think just having if everybody's in a good mood, that, I mean, all the other stuff will kind of like follow with it too, where if everybody's in a good mood, it's going to get an experience. And then other, clients are having a good experience, and then they tell people like, oh, everybody's really friendly there. And, they care, they listen to what I was saying. And like, I got a lot of value out of it. And, direct billing. Anyways, that's
a whole other can of worms.
Everything was done for me, which is why there's a draw to direct billing. But anyways, that's for something else. But it's like this overall, like, just like ease of accessing it, getting taken care of, everybody's in a good mood, and you felt like happy and supported. I mean, I think that's probably like a healthy business there. And then the other stuff, the money, all the other junk comes with it.
Totally. But like, happy people usually are well compensated people, and so there's like, they all fit together. Like, but I think that's a really cool angle to look at it, like using your front desk staff, your admin staff, like as the barometer, because all the shit falls on them. So, like all the follow-ups, all the, like they're the ones dealing with the community. They're the ones dealing with the public. So I think looking to them as your barometer is a really cool lens on that. I really like it.
That's good. Yeah. I mean, I don't think I was necessarily the one that came up with that way, but just like echoing, I don't remember who said that, but just like echoing like that whole like concept of just like, I mean, I not all clinics do it, because a lot of clinics, like, they totally get it, but I think like some of the time where it's just like, and you can tell to like some of the stuff, I'm just like, how do you like it here? Like, you feel appreciated.
You don't like your job.
And it's just like, and you can just tell. And so, I think definitely, just going by that as we done. I think, and just making sure like your front desk is compensated enough too, because I mean, like, they usually don't get paid as much, obviously, as like physio or whoever, but like, they need to make sure that they're, pay is one, I guess, way to kind of judge kind of like how they're being valued and I think to some extent as well.
But I think you're right. It boils down to culture. It boils down to culture and are people nice to be around and treating people respectfully and kindly? And are there some laughs happening? I actually think that's a huge part. Yeah. Being well compensated makes a huge difference too, of course. Mm-hmm. But yeah, having a happy work environment, there's nothing like it. Mm-hmm. There's nothing like it. Oh, I love it. Evan, we hardly even touched on. I've my whole list of things to talk about and points.
I'm going on tangents too much. I don't really.
No, but the tangents are weird. That's where the magic is. So I love it. We'll have to just do it again. That's we have way more things we can talk about and lots of that. So thank you so much for your time. I'm super pumped. And yeah, I appreciate it. We will definitely do it again. So thank you.
Yes, for sure. Yeah, thank you.
That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.